Okay, I just please, yeah, just wait here. My name is Dr. Asaad Shuja. I'm chairman and consultant of emergency medicine in a specialized medical center in Riyadh. I'm assistant professor in Well Cornell. I was in Qatar. Today, I'm going to talk about mannitol in head injury. Yes. Who can use mannitol in head injury? Show me. Any one of you guys use mannitol in head injury? No, this is not my talk.
No, this is my talk.
What happened? Oh, this is my talk, yes. It is like, anyone use mannitol in traumatic brain injury? In ER, not ICU, ER. No, no one. Eh? Okay, try today to convince you. No one. And this is the bad thing, you know, try. First of all, I disclose I don't have any interest or financial interest for mannitol. And this is my email. If you guys need any information or you need any consent to send me email in this one. Okay, now, yes. I'm not saying yes, but say yes. I want to see what the favorable to use mannitol in traumatic brain injury. It is helpful. Yesterday, we have like a gallery cruise in the boat. Now we're going to cruise in literature and see if there is evidence or there is any best practice to use mannitol in traumatic brain injury. Now, if you came here, you found in 1960, anyone born in 1960 here? Okay, there's some people there. Since 1960, most of the neurosurgical unit, you're younger, looks, man. Okay. Since 1960, most of the neurosurgical units use mannitol for traumatic brain injury and cerebral edema. Most of them. Now, what the mannitol? Usually they say it is surgical, like sugar alcohol because there's a sweet fructose there. And some people, they say osmotic diuresis because the action. Usually bolus, no one knows, 0.25 milligram or 1 gram per kg. Now, what the mechanism of mannitol? Now, mannitol, they in brain edema, like ICB. Also, they have use for renal. Also, they have problems. They have vascular. Any problems? This one is. And sometime in the vascular, they use it in rhabdomyolysis. But today, we're going to talk about mannitol in cerebral edema or increased ICB. Now, there is two immediate actions. This for like a medical student, about usually. There is two actions of mannitol in cerebral edema. One of them is plasma expansion. Another one, it is direct osmotic action. In plasma expansion, what happened? There's increased the regional cerebral microvascular blood flow and improve oxygenation. In osmotic action, what happened in mannitol? Between the plasma cells and brain cells, they try to extract the fluid from extracellular area to intravascular, which actually make less cerebral edema. This is the action. Now, traumatic foundation. The traumatic foundation, brain traumatic foundation, and the European brain injury consider mannitol in brain injury or edema or high ICB as a class 2 and 3 evidence to support use of mannitol to treat intracranial hypertension. Why they say that? We'll see now. In 1996, they did survey in UK. They found 100 people in UK, in neurosurgical, they use mannitol to control intracranial hypertension. 100%. It is like a practice. Okay, now in 2007, the Cochrane collaboration reviewed all the articles talking about mannitol and other drugs, and they found only 4 randomized control studies. The first randomized control study is comparing mannitol with hypertonic saline in traumatic brain injury. Another randomized control study, they compare mannitol with phenobarb in traumatic brain injury. The third randomized control they found in the authors, one of them, they are comparing mannitol with direct ICB measurement by using ICB monitor, comparing to standard care management without ICB monitor. They use the physiological and neurological monitor and indicator and see what the difference. The fourth study they found it, there is not a lot of study in Mannitol as a randomized control study. It's a pre-hospital Mannitol versus placebo in traumatic brain injury in pre-hospital. What they found? The reviewer found most of the conclusion that there is effective treatment of Mannitol to reduce ICB and cerebral edema and head injury. One of the trials, they talk about it here. Sorry, Hina. One trial comparing between, I mentioned that one. The reviewer found that the Mannitol for increase in the cardiac hemorrhage reduced the likelihood of death when they compare it with the phenobarb. This is the study I told you between Mannitol and phenobarb. They found that Mannitol decreased the likelihood of death compared to phenobarb. The second study, they found there is marginal benefit to reduce death and mortality if you're comparing Mannitol with hypertonic saline. Marginal benefit to reduce mortality. For the pre-hospital study, they didn't find enough data to support Mannitol in pre-hospital. For this, they need more study. In conclusion, Mannitol therapy, it is one of the good benefit to reduce likelihood of death compared to phenobarb. There is marginal benefit to reduce mortality in hypertonic saline. In pre-hospital, there is no good evidence. However, all those studies are small, not large randomized control study. This is, again, what you know, to be honest, it is not big or a large randomized control study. Now, there is some debate. Our debate here is giving bolus or infusion. In emergency, can giving bolus. And there is, as you know, brain injury and traumatic, there is a closed skull, right? And if there is a lot of cerebral edema, there is a problem. For this reason, this is the only medical management for severe traumatic brain injury with edema. For giving bolus, Mannitol is fine. The problem for infusion, there is some harmful and there is some side effect that. How long? There is a debate. For this reason, in emergency, we don't use it as infusion. There is some side effect of Mannitol if used as infusion, like, you know, electrolyte disturbance, high osmolarity, and there is sometimes demyelination syndrome. In conclusion and practice for me, I would like to use Mannitol as a bolus in traumatic brain injury, severe one, like some sign of ICB, as a bolus. Usually give it 0.25 milligram and 1 gram per kg over 20 to 30 minutes. Bolus, there is no problem, and is effective. And you can use it helping this guy before he's herniating. Presentation finished. Any question? Okay, next.